2011 because not only do we have a repeat appearance by Michael Soup, but we have some other superstars in the field of connecting people to the outdoors and gaining health from that. And so I'm going to let Michael introduce his panel, but I think I just need to once again thank Michael Soup for the leadership he is providing to all of us. It was certainly a wonderful accident that when he showed up in Washington to be a White House Fellow, he was assigned to the Department of the Interior. I mean, Michael, I don't know what we would have done had you gone to work over at HHS or something like that, but I certainly know we are all benefiting, and we will continue to benefit from the application of your wonderful leadership and your genius. I mean, Michael, as you've seen from his abbreviated biographical sketch in there, has all kinds of talents, but more than that, he's just fun to work with. So join me in welcoming Dr. Michael Soup back to Partners Edwards. Michael.
Well, hello everybody. This is, again, really wonderful to be back. This is, I think, in the last 7 years, probably the fourth or fifth time that I've been back to this meeting. The last one we did in Cavallo Point, as many of you remember, was really an eye-opener for me because it was one of the first times I actually came to a Partners Outdoors meeting and saw 3 or 4 other physicians in the audience. In the past, it's been a rather lonely journey through linking health and the outdoors together. As you know, this has been a personal kind of calling to some degree. It's a hobby. I'm a full-time orthopedic trauma surgeon at the University of Florida. Very busy level 1 trauma center, and at the same time feel that it's incredibly important to continue the work that Derek and all of you bring to linking healthcare, or at least the issues of personal well-being, health, and outdoor recreation, and the secondary things associated with that, such as stewardship and conservation. And so for me, it's been a tremendous journey through my own personal education outside of school to, as Derek will tell you the stories, when I first showed up in Washington as a White House Fellow, I had great designs on becoming the next Medicare guru, or the next guy who was going to design the best plan for healthcare in America, and then they sent me to the Department of the Interior. It took me a little while to understand that Smokey the Bear wasn't over there. And so I remember telling my wife that this might be the hardest assignment I've ever had, and I really had some very brief moments of thinking that I would quit the program and actually just go practice medicine. And she's much smarter than I, and she said, don't do it, this is an unbelievable experience. And within 3 days I met Derek Crandall, and we shared some ideas, and it was an immediate love fest between the two of us. He started talking about the potentials that outdoor recreation could have with personal and individual health. And the light bulb went off on me, and within a week of being there, I didn't even know my way around the building. I had to present to the secretary an idea that we together came up with on the link, or developing the link between personal health and outdoors. Just in a nutshell, we all know the statistics of obesity, and we've talked a lot about the needs for multiple sectors outside of just the healthcare delivery system to address our public health needs with chronic disease and prevention. Dr. Crompton did a wonderful job yesterday of really articulating, I think, a central element in this connection between the scientific societies and the outdoor recreation, and that he outlined for us that leisure sometimes has and I think he used the term flippant connotation, and if we focus too much on the context of leisure, then oftentimes it will be lost in the chorus of other voices trying to address what we consider to be serious issues. And I think medicine is not exempt from that. And so I think medicine's reluctance to kind of embrace the activities in outdoor recreation has somewhat been shadowed by some of those elements of irrelevance because of what we consider to be non-essential time. And so changing the language has been our focus over the last kind of 5 or 6 years, and I think we've done a very good job about doing that and demonstrating that physical activity is more than just your 30 minutes of treadmill exercise in the gym. It's more than just the calisthenics and the sit-ups that you'll do. And it's more than just the controlled environment where someone is cracking the whip and saying you have to do these things. But in fact, getting out of the chair is better than sitting in the chair. And getting out of the chair and doing something outside may actually have additional benefits outside of your cardiovascular rate and your pulse, but also has a more holistic impact when it comes to your mental health and well-being. And so a brief history over the last, what I consider to be the last 10 years on this, what we call it movement, can be instructional, because every time I come back to this, I know that we're taking another step forward in terms of the discussion. When I first started, probably 7 or 8 years ago on this discussion, it was really about convincing people that doing something outside was physically active, or that fell within the context of doing something more than just having fun. But you can have fun at the same time. And to the point where now, in the last year, we've developed some programs that are intended to help bring more and more medical professionals into the debate. You may have heard some aspects of park prescriptions, which is was really a note holder for kind of an overarching idea to bring medical professionals into this movement and link them to outdoor recreation. It's interesting because the park prescription movement, I think when we say that, most of you will recognize that there should be a connection to the medical profession. Prescriptions are medical. And that's really has been its intended purpose. But interestingly, if you look at the medical community reacted somewhat negatively to this idea, because the notion of prescriptions are somewhat sacred. It may also have some connotation with regard to pharmaceutical companies, or are we giving outdoors as a drug, or some of the most bizarre things you've ever heard, why doctors would like it. And I've shared this story with others, is that when you hear these doctors who say, well, I don't like the idea of park prescriptions, it's maybe symptomatic of being in the medical profession as a political activist, is they oftentimes offer no solutions. I just don't like it. And so I think we have to go back to the original purpose of what that was about. And if you think about it, its purpose was to engage medical professions. Simply to say, look, if you think about prescriptions, then you have a role. I don't care what you call it. You can call it, honeypot, or I don't know, or surfing. I don't care what you call it. But the bottom line is I don't care what you call it, as long as you understand that you are now part of a more global system, and that the outdoors plays a global role in the overall healthcare system. My colleague Daphne Miller is very articulate and excellent writer, and it's really been a godsend for me to find in this thing. You wouldn't find two more diametrically opposed physicians in this country. She is a family physician from San Francisco, the Bay Area, nutritionist, very, has some very strong ideas about what I should be eating, and I disagree with her entirely. And I'm an orthopedic trauma specialist in Jacksonville, Florida. We're totally opposite of the country, yet together we've combined on these ideas. And she discusses, and she actually brought this up as an interesting statement, that the outdoors and what we do, and I put on that hat, whenever I come back I put my Department of Interior hat back on. I said what we do in the outdoors with recreation and facilitating the connection to the outside is actually more than just a separate tourism, recreation, activity kind of thing, but you all are part of a global health system. And for this community to think of themselves as part of a healthcare delivery system may be a little bit unusual. But for the medical community to think of you all as part of their system is even more unusual. And so our challenges still remain, and I think that Compton made some interesting points yesterday about how the success in a lot of these public health type of movements when it comes to outdoors can be, you have to make it relevant, I think you said. And I think one of the things you said is you have to link it to an important social problem. And if we talk about health as you've identified, and there's very few things out there that really have more cachet than the issue of health. So how do we make you all relevant to the healthcare system? And that's what I'm hoping that we're going to talk a little bit about today. We have two fantastic panelists today. Many of the issues that we oftentimes bring up are centered around these ideas. Yes, we're outdoor people. We love to talk to the medical community, but sometimes our insurance companies don't return our phone calls because they don't really understand what we're saying. And so Dr. Sanchez, Eduardo Sanchez is here with us, and he didn't know this prior to me just saying it now, but he's going to be asked that question directly, and I hope we can get some answers from him. He's the Vice President and Chief Medical Officer for Blue Cross Blue Shield of Texas. Before this, he's had a long history in public policy and health policy, by working at the University of Texas School of Public Health, worked as a public health commissioner for the state, and has been really involved in the issues with regard to public health, disease prevention, through either his practice as a family physician or through his administrative political positions that he now occupies as well. And he does so also on the national level by participating with the CDC on obesity prevention and disease prevention projects for the United States. Also sitting next to him is Nancy Herron, who's a longtime conservation advocate, educator, I should say, and a community leader, and is currently involved with a group which we probably all know very well, and that's the Children in Nature Network. I don't think there's a person in here who's not familiar or hasn't read Richard Lou's book on No Child Left Inside, or No Child Left Inside, but Last Child in the Woods, and from which the Children in Nature Network has arisen. She's got some really great ideas and things about how to connect children with nature and connect them with health. So without further ado, I'd like to introduce Dr. Sanchez to perhaps give us some insight onto the connections in medicine.
Thanks.